Hey Underdogs, it's UDP Therapy here today, and we are talking about ringbone. Now again, this is the audio version, but if you would prefer to read, head on over to my Facebook, and you can read it instead. Just scroll a little bit back. But pretty much, I was scrolling through Facebook, and I saw someone ask about corrections for ringbone. They're already working with a vet and a farrier, but just wanted some additional advice. And this intrigued me to want to kind of make a post about ringbone, because I have done extensive research on ringbone, but I do want to say, so pretty much, I'm a farrier, I'm a body worker. However, the reason I didn't want to give farrier advice to this person is while I've worked on other corrections, I have not had hands-on experience with ringbone. So while I kind of knew what to say, I didn't feel comfortable telling someone what to do when I don't personally have that hands-on experience. Plus, they have their own farrier. I figured their farrier would tell them what to kind of do and what to kind of have a game plan for. So I knew their farrier was handling it. Let me give some body work and flexion advice, corrective exercises to do to help get better mobility and flexion in that leg. Because I do have hands-on experience with ringbone from a body worker perspective. Well, someone hopped on who is not a farrier, not a professional in any way, shape, or form, and that is no hate to them at all. However, they said there is no way that body work would ever help a horse with ringbone. I personally disagree. So that really pushed me to want to make a post about how body work can help ringbone. And if you don't see that body work can help a joint, I get it. Hear me out. We're going to come back to this at the end. And so I do want to point out, because I know people are going to think, well, you don't have hands-on experience with ringbone from a farrier perspective, so how can you say that? Well, I don't have hands-on experience, and that is why I will not be working on a ringbone horse anytime soon with equipment. I do know the facts. This is research from textbooks, articles, all of the professionals. I read as often as I can. I listen to podcasts. I read on websites, books, everything. So I have the facts. I just don't feel comfortable putting myself out there and saying, like, yeah, I can correct it. Because I have not had that hands-on experience yet. But I know the facts. And today we're going to be discussing the facts. Causes, symptoms, how to diagnose, things like that. Again, don't go just off a YouTube video, though. I want to say be sure to speak with your vet and be sure to speak with your farrier. Because those are your two experts, and those are the people that know your horse best, because you have them out every 6 to 8 weeks, and you have your vet out for vaccines, and they know your horses. So, with that being said, let's get into this. So, ringbone occurs when the soft tissues in both the pastern and heel are subjected to repeated strain and trauma, creating inflammation. The body responds to this by depositing calcium to the area. If it continues, it creates ringbone, which is calcification of collateral and suspensory ligaments along the front of the pastern. It is a progressive condition, meaning it worsens over time. Ringbone is typically seen in high-performance and older horses whose careers involved repeated concussion or twisting, which strains the pastern joint. This being primarily jumpers, parade or driving horses, and barrel horses. Conformation faults such as small feet, especially if small feet is paired with a heavy body, or upright pasterns tend to have a higher risk. The calcification of the joint will become visible as a hardened ridge of bone across the front and sides of the pastern, and can be felt during flexion of pastern joint. It is more common to appear in both front limbs, and maybe more severe in one than the other. Ringbone is a degenerative condition affecting bones and joints in the lower limbs. The surrounding connective tissues inflame, triggering the formation of bony growths around the joint in the front of the limb in pastern or coffin joint. This could result in permanent fusion of bones in the joint. It is a form of osteoarthritis, meaning a degenerative joint disease involving degeneration of joint cartilage and underlying bone. It is characterized by development of bony growths called, forgive me if I pronounce this wrong, exostosis along the edges of the joint, which form in an attempt to repair and stabilize. This reduces the range of motion. Strained areas can involve tearing of ligaments away from bone, resulting in inflammation. The pastern plays a vital role in shock absorption, providing support during movement. It cushions impact of weight and forces during locomotion. It is important the pastern joint be as healthy and mobile as possible. Ringbone is split into multiple categories. High ringbone, proximal interphalangeal PIP joint arthritis, which affects the pastern joint. This is P1, the long pastern bone, and P2, the short pastern bone. This can be seen in the pastern joint, P1 and P2. Low ringbone, distal interphalangeal dip joint arthritis. And by dip and PIP, I mean if you take the words together, is it called an acronym? I'm not an English teacher. Distal interphalangeal joint arthritis, DIP. Dip and PIP. I think it's super cool. I like dip and PIP. I'm going to use that word all the time now. This affects the short pastern bone, again, but rather than long pastern bone, it is paired with P3, or the coffin bone, also called the distal phalanx, which is how we get dip. So P2 and P3 instead of P1 and P2. And P2 and P3 are both found inside the foot. So P1 is outside the foot, that's our pastern bone. The joint is connected to P2, our short pastern, make that pastern joint. But P2, the short pastern, is halfway between the pastern and halfway into the foot, more like a quarter into the foot. And then it connects to the coffin bone, which is fully submerged in the foot. So when you look inside the foot, it is just below the coronary band inside that foot. However, we can further organize it outside of high pastern, low pastern. Outside of high ringbone and low ringbone, we also have articular and non-articular. So articular is the development of bony growths on the joint surface itself. More severe lameness and joint pain can be noted. Bony growths directly affect the joint surface. Periosteum, the outer sheath of bone, becomes inflamed due to stress-induced pulling on surrounding ligaments. This creates a bone growth. This is common in draft horses. Inflammation of the joint itself. If the joints are afflicted, the horse experiences pain during the rotation of the joint with each step. The ossification progress can progress all the way until the joint loses complete mobility. Non-articular. Periarticular ringbone. Bone growths are outside the joint, in surrounding tissues, tendons, and ligaments. Lameness typically is mild to moderate and usually in high ringbone. Oftentimes, ligaments tear. If the growth lies under or alongside a tendon or ligament, the tendon or ligament, will seesaw against the growth with every movement of the leg, causing immense pain. Symptoms include visual growth on the pastern, which can be felt in a flexion test, lameness, joint and ligament swelling, pain during flexion, loss of mobility, heat, a stiff and shortened stride, difficulty turning, or difficulty moving forward. Causes include heavy work and concussion, conformation deformalities and faults, trauma and injury, wear and tear, osteochondrosis, OC, repetitive stress, genetic predisposition, and chronic inflammation. Impaired shock absorption caused by shoeing also tends to influence ringbone. In shod and barefoot horses, contracted heels and underrun heels also impair shock absorption, which both of those would lead to ringbone. So some farriers like to shoe to cure ring bone. They like a lot of shoes, corrective shoeing. A lot of newer farriers say, okay, after new research comes out, let's keep them barefoot to cure ring bone and work heavy on gaining that shock absorption back. So it kind of just depends on the farrier there. Diagnosis is done by a flexion and movement exam, palpation, x-rays, and nerve blocks. X-rays usually being the most common. Treatment strategies. Be sure to work with a vet and an experienced farrier for any of this, and anything that does not require a vet or an experienced farrier should be used as support rather than the actual cure itself. Work with your farrier and vet. Medications such as NSAIDs are beneficial to reduce pain and inflammation. Herbal meds may also be worth looking into to support healing and balance. Injections, primarily corticosteroid or hyaluronic acid, are recommended to support the joint. I don't know a lot about joint injections, so I don't want to elaborate on that too much. I'm working on reading a book to further educate myself on injections, however, that is what most vets will recommend. Nutrition, including joint supplements and anti-inflammatories, are beneficial in the joint's health. Omega-3 fatty acids and MSM are especially recommended. Sorry about the guinea pigs. Corrective trimming to enhance breakover are especially useful. Breakover is going to be your best friend while trying to heal and support. A rolled toe is recommended and oftentimes changed the point of breakover by shortening the toe is used. Reduce the leverage of the foot. Minimizing concussion is important. Minimize the peripheral loading, which is when the wall holds most of the weight rather than being balanced overall. This reduces blood flow and shock absorption. Trim the toe to a balanced length, 3 1/4 recommended, and allow heel to grow to a healthy and open length and angle. Shorten breakover, which will quicken it. For proper shock absorption and circulation, allow the frog to grow strong and healthy and make contact with the ground. If frog atrophies or is trimmed too short, it will not work for this purpose. A natural angle and length is often recommended, especially if you are to focus on a shoe job over a barefoot trim. Corrective shoeing. Again, our job is to ease breakover. Oftentimes for corrective shoers, they go with something more severe than a rolled shoe and instead use a rocker shoe for a stronger correction. Rocker shoes ease breakover by providing a rocker or rolled motion. This reduces strain. A bar shoe is commonly used, though, or oftentimes farriers will pair an open shoe with pads to support the heels. If a bar shoe is the route they go with, it is usually an egg bar. Some like a heart bar, but I personally don't recommend this as it cuts circulation through the frog. This defeats the purpose of gaining circulation. With an egg bar, it provides support for heel and frog to distribute weight evenly and reduce strain. A wide web shoe provides greater surface area for contact with the ground to increase stability. A full roller motion shoe can aid in easing some rotation in restricted joints. For this shoe, you would roll the toe and thin the heels. Oftentimes, farriers will also weld a 5/8 inch half-round steel across the shoe. The biggest goal with shoes, besides breakover, is to support the heels. I personally feel the best support for heels is a barefoot. However, oftentimes ringbone horses require a shoe to stay sound and comfortable. Surgery is often used, especially in severe cases, specifically the pastern joint fusion. Apologies if I pronounce this wrong. Arthrodesis surgery. Physical therapy and corrective exercises are highly beneficial. I recommend the book 55 Corrective Exercises for Horses by Jack Aristotle Ballou. Cavalettis and pole work are especially beneficial to aid in movement and postural corrections. Due to the lack of flexion and mobility in the joint, it is best to do this work to maintain as much of this as you can and done correctly. Be sure to check out videos from professionals to ensure they are using themselves correctly over each pull and so you know how to correct it. I will note I have one on my YouTube, but it's super outdated, so I need to reshoot it. The information is technically correct, but it was one of my first times really getting into Cavaletti work. So I would check out Superior Therapy, Caliente Therapy, I believe I'm pronouncing that correctly. And there's also a course by Holistic Animal Studies by Angelique. That one I will also recommend, but it's a little bit pricey if you go the certification course route. The book will pretty much tell you everything you need to know, though. One advice I can give for cavalettis is always make sure they are leading with the inside foot over the pole. If they are leading with their outside foot, they are compensating somewhere. So then you have to either add a step or take away a step to make sure that they lead with that inside foot. Rest and turnout are also important. Horses with arthritis and without should be provided with as much movement as they can if sound. Movement helps circulation, mobility, and flexion, as well as overall health. Acupuncture and pressure alleviates pain, reduces inflammation, and improves circulation. So that might be something to look into. There's a lot of acupressure points right in that pastern coronary band area, so that would definitely help a lot. Liniments and poultice are also worth applying to reduce inflammation. The liniments and poultice I recommend would definitely be DAC, which you can get from Cyndi Wolf. That would also support me as I am a sponsor. I really like the DAC. I use it for all of my horses. It's really good ingredients, and it's really strong. If you have a sensitive horse, then I would go with Quietude by Culture. It's CBD focused, and it's supposed to be a little bit gentler. Comparing strength, I think DAC would be stronger, but this would be good for sensitive horses. Draw It Out is also a really good liniment to look into. Magnoive is beneficial not only for the whole body self-healing, but can also increase circulation, reduce pain and inflammation in the entire system, including the foot and pastern. Red light is also good for this. Hoof boots may also be worth trying, as it is important for shock absorption and circulation to the foot and may provide an extra cushion for the joint if you get a quality brand. Shock absorption is important for horses affected by ringbone, and boots definitely do that. Keyword there is quality brand. So if you get a brand that is not a quality hoof boot, it can actually do more damage because it can feel like standing on cement or a hard surface all day, which is not good for shock absorption, circulation, and all of that stuff. So personally, I like the soft ride boots, the soft rider. That is usually the ones I shoot for, because I see the quality materials they're using, the pad is soft, and it provides perfect circulation. So if you're going to get hoof boots, I would go with soft ride or something like that. I've heard good about cloud boots, I think, but I have not personally tried those. I usually go for the soft rider. It's a little bit pricey, but you're getting your money's worth because it lasts a long time and is actually benefiting your horse, where a lot of cheaper ones, unfortunately, do more harm than good. The other thing that would be good is kinesiology tape, KT tape. Oftentimes it is used as they bring circulation to the area, as well as aid in proprioception for better mobility. There are many hoof and pastern tapings to be used, all fairly simple to do. A common one is one eye tape wrapped around the coronary band, half on skin and half on the hoof. So you take one eye tape and you wrap it around one time, and it's supposed to give better circulation to that area as it lifts the skin. The proprioception is also where it sends a signal to the brain, and they pick up their feet how they're supposed to a little bit easier. So it'll help with their mobility and flexion. Stretches and mobilizations are great and highly recommended. Not only will this improve posture, but it will create better flexion and mobility in the leg. This is very beneficial for the joint, which is restricted. There are many stretches available on my YouTube and in books. One personal favorite I do for ringbone horses is grabbing the foot as if to pick it out and holding my hand around the sole and wall. Slowly, I move the foot and in turn the pastern joint in a circular motion for 30 seconds clockwise, then 30 seconds counterclockwise. Then I will do 30 seconds of up and down motion. This is for the front feet. Hinds, I usually only go up and down for 30 seconds, as it's a little more restricted in how the joint is set up, so circles are a little bit harder. So I usually just go up and down for the hinds. This is my personal favorite for pastern flexion. However, there are many good stretches to benefit the entire system. Another thing you can do isn't really a stretch, but just to check your horse's health. While you pick out your horse's feet, take a look at that pastern. you'll see that hairline there. It should be in a straight line. If it's jagged, then you know there's something wrong. Could be in nutrition, could be inflection, things like that. Lymphatic drainage techniques prevent stocking up. So lymph drainage stimulates lymph vessels to increase transport of lymphatic fluid, which helps in transporting waste to kidneys and liver to then get rid of it. If it gets stuck, the lymph fluid pools and creates stocking up. Lack of movement does not help this, so draining techniques can be beneficial. So if you notice that the loss of flexion and mobility is creating stocking up, then a lymphatic drainage technique might be beneficial for you. Bodywork, though, is my biggest recommendation for support techniques. Of course, your farrier is the solution, and everything should be discussed with them as they are the main healer, but bodywork is the support to work alongside and aid in recovery, even if it can't solve it. Oftentimes when a horse is sore, in fact, no, every time a horse is sore or lame, the body will compensate to try and alleviate the pain. Compensation creates more pain, and it becomes a cycle of pain. Bodywork breaks this cycle, reducing pain and improving mobility and flexion throughout the body. While it doesn't directly impact the pastern joint, it prevents the pain from spreading throughout the body through compensation patterns, creating muscle pain. Anytime you have an issue in the body, it will translate to and restrict the muscles. Bodywork prevents this. When ringbone reduces flexion, it is important to aid the body by trying to bring as much flexion back as you can. If you have any questions, please do not hesitate to ask, and if you're interested in setting up bodywork and farrier work, please PM me to set up. So yeah, that's pretty much the post. You can find it on my Facebook. Hope you guys enjoyed this video, and again, if you have any questions, don't hesitate to ask. If I don't have the answer currently, I will research until I find that answer. And yeah, I hope you guys enjoyed this video. I will see you guys.